I wanted to talk with you about a question that I get asked a lot, and that is, do I have to take medication for depression? So I want to start with a story. This goes back probably 15 years or more to the early 2000s. I was in graduate school at the time, and my wife and I were invited to go down to the beach with friends of ours who were staying there with parents. They had a place down there at the shore. And I remember a conversation that I had with my friend's dad. I don't remember anything else we talked about on this trip, but he was asking me what I did, and I said I was a psychologist and I was doing research and training to do therapy. And he said, "Oh, I'm surprised that you're still being trained to do therapy. I thought, now that we understand that things like depression are caused by changes in the brain, then all the treatments are going to be things like medication. So treatments that work directly on our physiology." And I think it stuck with me because it's such a common way of thinking that there's, as we learn more about the brain and we learn how our thoughts, our behavior, and our mood seem to be represented in the brain, then there's this assumption that if we want to make any changes, like relieving depression, then we're going to have to do something directly to the brain, like giving a medication, like usually something like fluoxetine or Prozac. This is one of the common selective serotonin reuptake inhibitors, or SSRIs. Now, this actually relies on this understanding of causes of depression that has surprisingly basically no clear evidence to support it. And this may be surprising to a lot of people, but there's this story we've been told, and you've probably seen little illustrations showing synapses and the release of serotonin into the synapse, and how a medication like fluoxetine causes more serotonin to be available in the synapse. And so what people have assumed is that depression is caused by low serotonin. But in fact, that doesn't seem to be the case. This might be surprising. If you give a medication and it boosts serotonin and a person's depression, more often than with placebo, gets better, doesn't that mean there was low serotonin? But I think a simple analogy shows that's not necessarily the case. So a medication like aspirin, or acetyl salicylic acid, is pretty effective in relieving headaches, but we don't assume that if you have a headache, it must be that your body is low in acetyl salicylic acid. And I think what we often forget is, just as the brain can affect our thoughts, our behavior, our mood, we can do things. We can think in certain ways, we can act in certain ways that directly affect our brain. And there are studies showing that when we do an effective therapy, we actually see changes in the brain. Sometimes they're similar changes to what we see with medication treatments. Sometimes they're different types of changes. And if you want to learn more about this idea of a chemical imbalance in depression, I'll put a link in the description for more information. But nevertheless, a lot of times when a person gets a diagnosis of depression, they might assume, well, I guess now I need to take medication, or maybe they have family members who, with absolutely the best of intentions, are saying, look, you need to talk to your doctor, get a prescription, you have depression, you need medication. But sometimes people, for various reasons, are hesitant to take a medication. Some are concerned about side effects. Common ones with SSRIs can be things like nausea, dizziness. A lot of people don't like the sexual side effects, like low sex drive or difficulty reaching orgasm. Some people also prefer to try therapy to learn some new skills rather than directly changing their brain chemistry with a medication. But thankfully, there are other treatments that can be quite effective. There are many, many studies showing that therapy can be a really effective way to relieve depression. The best tested treatments are CBT treatments, so cognitive behavioral therapy, and this includes usually 3 parts. So challenging thoughts, that's the cognitive part. So there are ways of thinking that often contribute to depression. So telling myself things like I'm a loser or I'm worthless can definitely feed into that, those feelings of low self-worth and low mood. Behavioral activation, this is a super simple approach, but it's extremely effective, and it just involves doing more rewarding things in our lives. So either things that are fun and enjoyable that we're probably doing less of because of the depression, or things that give us a sense of accomplishment because they're important for us to take care of. And then the third component, this is a more recent addition, but it involves mindfulness. So training our attention to be more present, being more engaged with the things that we're doing, starting to develop a different relationship with our thoughts and with our emotions. Now, research does show that the common medications for depression can be as effective as CBT, at least in the short term, at least as long as a person is taking the medication. And a lot of people find these medications to be extremely helpful, even life-saving in some cases. So I'm definitely not discouraging someone from taking medication if they want to, if they find it helpful. And there's certainly no reason to feel bad about taking medication that's helpful. What we do tend to see is that in the long term, a psychological treatment like CBT tends to be more effective, especially once treatment is over. So if a person stops taking medication, then they no longer have that active treatment, whereas with CBT, you've learned some skills that then you can take with you, continue to practice. If anything, the effects of CBT can actually increase if we continue to use these skills consistently, if we keep being mindful about our thoughts, planning our actions carefully, practicing some of the mindful awareness techniques. So these are some of the things to consider when making that decision. It's a very personal choice, something to think about carefully, talk with a loved one about it. And if you're interested in therapy, you can talk with your doctor and see if CBT might be right for you. Thanks for watching.